Right, we've now got Khalil Secker give us a report about his workshop.
My workshop was about supporting each other across Manchester. So the first one was to keep our NHS Public as a network umbrella to keep people connected, provide speakers, information on CCGs, advice, etc. for grassroots activists, whether or not you're in Keep Our NHS Public. So me personally, I'm part of a group called Save Our NHS within the Students' Union. And although we're separate, we do use a lot of Keep Our NHS Public's resources online. I had a meeting with Hugh Capity yesterday. We sat down for about an hour and a half. He gave me a lot of advice on how we can set up a successful campaign. We've talked about a potential week of action in Manchester, bringing together all the different campaign groups, which obviously require a lot of planning and organisation in the run-up to it. Emphasise the link between deprivation and austerity and the knock-on effect to public health, and that is obviously the poorest who are the hardest hit. Salford campaign, we're talking about how they want to link up more with other groups, like especially our group as well is quite new. We do need that kind of that support, that advice, and we just need more linking and communication in general. Tied together what's happening to other public services. It's the same agenda of cuts and privatisation. Most notably, the fire service is now looking to get privatised. The Fire Brigade Union is amazing, and they're very, very, very left. The General Secretary spoke at the rally at the end of the Lewisham NHS march of 25,000 people, and he was drawing together the links between what's happening to the fire service and what's happening to the NHS, what's happening to the police, what's happening to the rail system, post office, everything. We put regular NHS users at the heart of the campaign to raise awareness amongst the wider community. A lot of people don't realise what it's like to have a chronic illness and be faced with the poor care that you get from the NHS now. And we need to use anecdotal evidence of stories, people who've been mistreated and don't get the care that they need, and publicise those stories within the wider community of people who might not be aware of it. Linking back to what the Trafford General campaign did of emphasising the importance of the community and using people power, and that power then having a knock-on effect to pressure councillors and MPs to actually get off their arse and pressure the government. The 1st of April, it was noted, the 1st of April is just a formal date for CCGs taking over from PCTs. In reality, it's pretty much already happened. We need to knowledge share through a central umbrella website, so that could be Keep Our NHS Public, it could be a CUC website, or it could be falseeconomy.org, which is pretty good for linking up local groups. CCG public meetings are during the day, so not everyone can go. We need to coordinate to find available people, for example, retired members or students. Which brings me on to we need to engage young people more. Like there's not many young people here today. Myself, I'm campaigns officer at Manchester Students' Union. I took a year out from medicine to do this job, to set up a Save Our NHS campaign, and we're looking to have a knock-on effect to Salford and Manchester Metropolitan. I'm also putting forward a motion to any National Union students, their national conference, that they should run a national campaign. Because so far they've been focused on cuts to education, but they've been ignoring all of the hundreds of thousands of healthcare students across the country and how cuts are affecting students at a local level. So one example is that one thing they can do is welfare officers all around the country, we've got one at Manchester Students' Union, sit on public patient advisory groups which influence CCGs. So NUS now has this unexpected role right at the heart of the decision-making process, which they can influence their student leaders and coordinate with Keep Our NHS Public and the trade unions. Students' unions, we've got some money. Like I'm not going to ask for money from Keep Our NHS Public, because the Students' Union's campaign budget, there's £2,000 a month to bid into, and any student can bid for that money to run an NHS campaign. I've been making lots of use of it. Like, if you can link up with students and get them to use their Students' Union, that's a whole other untapped resource that we need to make use of. And then obviously, like, young people who don't go to university, so community groups like Retract, Reclaim, the boxing club at Moss Side Fire Station, they've done an amazing job. And also talk about a big public meeting in March or April to help plan for a week of action, potentially in May. All of this was just talk about ideas in the pipeline.